And now I would like to welcome Dr. Mary. Can proceed with the next programs. Welcome.
Thank you. Good afternoon. Good afternoon. Karibuni. Si wote tumekula lunch. Okay, so my name is Dr. Mary Nicholas Suke. I'm the program manager AHDA. And I will start by giving a short introduction about our organization. So, Amplify Health and Development in Africa is a youth-led organization registered in Tanzania in August 2023 by a team of youth who are experts in health and communications. We have 3 pillars, which are climate health and change, community development, and health system strengthening. And then our approach is through advocacy, community advocacy, storytelling, community engagement, and communications for actions. Since our registration, we have started doing different projects involving ourselves in collaborations and on-ground activities that we started this early January with the successful as follows. So in February this year, we participated in training community healthcare workers on climate change and health basing on malaria, equipping them with medical equipment like microscope, teaching them how they can deliver, how they can be delivering the education of climate change and health in mode of preventive ways. And also we also equip them with bicycles so that it could help them on moving from one household to another household, providing education. As well as we published a book called Ziada and Onyo. This book, it explains it aimed to reach the population of young people, mostly in primary schools and secondary schools, elaborating on malaria, and it was distributed in primary schools in Lindi. It was about 3,000 copies. And then we conducted a panel discussion at a local level. This panel discussion involved primarily local leaders with community members and community health workers, where they had a chance to discuss on strategies and preventive way on tackling climate change and health. Also, so these are the medical equipment I was speaking about. We distributed the microscopes and other laboratory reagents. And then also we conducted online webinars where we provided a platform to youth and give them a chance to discuss the role of a youth in tackling climate change and health. And through that, with the continuation of that video as part of storytelling, we were able to document a documentary showing the effects of flood in areas which were primarily not known to be used to getting such events. We documented it in Moshi, Tanzania. And this documentary was successful use in the launch of Profiles for Climate Change at Baku in the Forecasting Health Future Summit this year. So that is a little summary of what we have done, what we have achieved, but we still have other things that we are looking forward. We are looking for partnership. We are looking for other things as to do. So this forum, being another successful story, will base on climate change and health. We'll have a panel discussion followed with a discussion. It's more of conservation, like discussion. We'll break into group discussion. We all break down the points set up the strategies. So to kickstart our forum, I would like to welcome Mr. Alois Urasa, who is our interim director. Let me read the bio. So he's a public health specialist and with a background in health laboratory science and specialized in health system implementation and research. You're welcome.
Thank you very much, Dr. Mary, for that wonderful introduction about AHDA. And it's really our pleasure being here today, hosting this important discussion or forum on climate change and health. And as Mary just explained, the organization was formally registered last year, and we started our operations last year as young people. We are still setting up the ground, but one of the things that we looked at that was very important to address is climate change and health, and particularly from the community level, looking at what can communities do to respond to the immediate actions, to the immediate challenges of climate change and health. We started focusing on the southern part of Tanzania and partially in the northern part of Tanzania, as he said, and we are looking at linking the story and the data. We know that scientists have conducted a number of researches. There is a lot of information about the nexus of climate change and health, the impacts of environment to the health, but then how do we link the real stories of this impact to the data that is available? We know there are so many global discussions on climate change and health, but how does that translate to the community? How does all that discussion, all the principles, all the declarations, and I know Tanzania is one of the countries that endorsed the climate change and health principles last year at COP28, but what does that really mean for our communities? When you talk of food insecurity, these problems are real on the ground. When you talk of malnutrition being exacerbated with impacts of climate change, from drought, from floods destroying the crop production and everything, these things are happening down in the community. How does these principles and high-level discussions really translate to what is the need of the community? And today we are hosting this important forum that we find it an important forum or discussion where we come out with resolutions, or rather I might call an agreement, or it might not be binding, but just a commitment from the individual level, a commitment from a group level as coming from the private sector, from the government sector, from the NGO sector. What do we feel or what do we see we can really do? What action do we want to take at a community level? And today I'm joined with a group of experts it's a mixed group of experts. We have from the government, from the non-government sector, we have those who have done the community work, and those who have been engaging with young people. It's like we have a father, a mother, and children discussing this important issue. What do they have to tell us? And to set the scene, I like now to call on the stage the father from that panel, that is Dr. Ntuli. Dr. Ntuli, clap your hands for Dr. Ntuli, please. Yeah. So Dr. Ntuli is an author. Today I want to challenge Dr. Ntuli. How does all these good things he writes about health system, how do they really translate to the community level? And being an expert sitting at the Ministry of Health, dealing with all these policies, how do these things really work for our people on the ground? Dr. Ntuli, before we go to that challenge, can you set a scene for us and tell us what is really the nexus? When you talk of resilience, when you talk of communities, when you talk of health system strengthening, what does it really mean? Over to you.
Thank you very much, and I'm happy to be part of this panel discussing a very pertinent issue at the global, regional, and the country level. So resilience simply means withstanding or recovering from shock. You know, time to time we shall be experiencing shocks in terms of emergencies, in terms of the disease outbreaks, pandemics, but how our system cope and recover from those shocks is what it means by saying the resilience. But what is a health system? A health system simply consists of organization, people, and actions whose primary intent is to restore and maintain health. So these two words oftentimes are used interchangeably, but they do not mean the same thing. But WHO tried to unpack the health system into the building blocks. They presented the 6 building blocks, starting with human resource for health, leadership and governance, healthcare financing, health management information system, service delivery, and supply chain management, without forgetting the community. But last year, I, together with my colleagues, we published a book on the primary healthcare, where we challenged the 6 building blocks, because we felt that it didn't include some of the very important elements as far as the health system is concerned. So we looked at the global level, we looked at the global health initiatives, the Global Fund, the Gavi, and we have WHO, UNICEF. All these big organizations, they have got a lot of bearing into our healthcare systems, the way our healthcare system performs. So they can introduce vertical programs, and these affects the way our healthcare system performs. And also we did include the other thing, the political determinants of health. Much as we want to advance the health agenda, we need to get the political buy-in. We need the political will. And this through political will, where the private and public sectors comes together. And it's through the political will when we actually make sure that we endorse and accept some of the international agreements, including the Paris declarations, the Brazzaville, all these actually resolutions which are put at the global, continental, at the national level. And also we did include the social determinants of health. These are the key important factors, because the way people seek healthcare, the health-seeking behavior, it determines how the health system performs. Last but not least, the commercial determinants. Here we speak about having health diets, physical activities, but we have the salt industry promoting use of salt. We have the sugar industry promoting the sugar use. And then we have the tobacco industry promoting the tobacco use. So all these is what makes really, I, together with some of my colleagues who are in this room, we thought we needed to write something on the new 6 building blocks, which are necessary to advancing the health system at the global, regional, and at the national level. Thank you.
Yes, thank you. Yeah, thank you very much, Dr. Ntuli. You have really given us food of thought and great digestion on what health systems really mean and why it is important to have all these policies, the political commitments, social determinants, and so on and so forth. But before I invite the next panelists on the stage, Dr. Mary mentioned that we took one of the stories from the community to one of the largest climate change and health that sets a scene for the Conference of Parties, COP29, that is coming up in Baku, Azerbaijan. It was a short story. We just filmed one of our colleagues, what we do on the ground, and it was featured at Forecasting Health Futures in June. Maybe we can play that, and then I'll call on the next panelists. Over. Sound? Sorry, I hope they are sorting that quickly.
Of killing more people than ever, despite great efforts to control and eliminate. From the shadow of Mount Kilimanjaro in Tanzania, a country blessed with varieties of natural and attractive features, we meet Isaac Kaniki, a dedicated medical laboratory scientist, a youth leader for health, who found his passion in addressing health impacts for climate change through community action and advocacy.
For years now, I have been a malaria champion advocating for increased resources at continental, national, as well as local levels. And through this initiative, I have been collaborating with my colleagues in implementing community actions like raising awareness on the fight against malaria, distributing mosquito nets in hard-to-reach areas, as well as mapping the needs of communities in hard-to-reach places.
Beyond the lab, Isaac immerses himself in workshops and leadership roles, sharing skills in disease prevention and community health development.
In our recent activities that we conducted in southern Tanzania, due to disrupted connection of roads, hindered us to deliver services like reaching community health workers. Communities can play significant role with regard to the links between climate change and health. I and my colleagues at Amplify Health and Development in Africa, we did a community activities where we got very inspiring actions, stories of actions that are happening at community. And we learned that increasing resources that will equip them with the necessary tools for them to work effectively. One best thing that we learned, communities act as potential informers, potential source of information regarding the climate action that we can drive at community level. And they act as both information source as well as collectors of information from the community itself, which is important in tailoring the evidence-based solutions. If we were prepared, there would be no fear of floods, and together we can turn the tide against the impact of climate change on Earth.
Yes, thank you. So this was just a short story of what young people are doing in Tanzania, what we are doing within the communities. And my challenge to the team, I'm just an interim leading the team, is what are you taking to COP29 as the response from Tanzania in responding to the threats of climate change and health? And maybe before I go to Isaac, who was just presented here, I'll invite Dr. Florence Tem, the mother from the panel. Dr. Florence Tem is currently a country director of AMREF Health Africa in Tanzania, and previously a country director for AMREF Ethiopia. Prior to joining AMREF, she was the head of cancer prevention at Ocean Road Cancer Institute in Tanzania, also general practitioner and researcher under maternal and HIV research projects at Muhimbili National Hospital. Dr. Tem holds a number of degrees in medicine, Masters of Public Health, Diploma in Palliative Care, University Certificate in Geriatric Health, and now conducting her MSc in Global Management. She has undergone a number of leadership roles, as I mentioned. And today, I don't know if I'm correct, politically correct, using the word challenging. AMREF colleagues will hold my neck after here that I'm going to challenge their director. With all the leadership roles and the work you have done, not only for Tanzania, but also for Ethiopia, and the work you have done in a number of sectors beyond community works, beyond NGO, working at a national hospital, you have seen right-hand impacts of climate change. And you have seen the really challenges that communities faces when it comes to climate change and health, which is really exacerbating what has already been there. We know there's already poverty, malaria has been there despite climate change, NTDs have been there despite climate change, pulmonary diseases and everything, and you are a mother, you know how this challenges the health of a child. And now leading one of the biggest NGOs in Tanzania. What is your perspective on the role of non-state actors like NGOs and CSOs beyond AMREF that could effectively support the policies and all the good things that Dr. Ntuli has just mentioned?
I wonder, okay, thank you, moderator, thank you so much, and good afternoon, everyone. Maybe I would like to ask the first question before I answer your question to the audience. Just to know how many of us in the room that have got an intervention or a program around climate change.
I see one.
At least your organization has got something to do around climate change. Okay. And a good number of them are from AMREF, actually.
Can you clap for AMREF?
Yeah, talking about climate change, I must say, for instance, you call me mother, right? But when I was a child, even a young girl by then, I heard about these things like global warming, ozone layer, things like that, greenhouse gases, but didn't know what is that to do with my health. And even during the training, in the medical training, it did not come out strongly as it is now. So I must say you young people are lucky that now the health sector is bringing climate change into the table. And the thing was not that the climate change experts were not bringing in health people, but health people are also not seeing the connection. So now it's very obvious that the change that we see from the all extreme weathers, rising temperatures, elevated levels of sea level, they all affect a number of things. And I have a certain slide I wish to show, if someone can help me to just show that slide from the Africa Center for Strategic Studies. That will also help as I try to explain. But asking the role of NGOs as ourselves is actually to make sure that that language is clearly and well understood by each and everyone from the household level, community level, in a simplified language. I think we are using very strong technical languages to communicate things that are happening within people's surroundings and life. Climate change has got significant influence in how people are born, raised, grow, work in the environment. And all this, from what my colleague here said, is all about social determinants, because social determinants basically are factors or conditions where people are born, grow, live, and work. So it's actually, climate change has got a significant influence. So going through this cascade of that, you realize it affects our lives. So even when we talk about SDGs, though there's one SDG, SDG 13, is surrounding climate change, but all 17 SDG has got impact around climate change. So look at this picture, you realize this was a report that came out back like 8 years ago, but it was released by Africa Center for Strategic Studies. And you can see the way they connected all the effects from the sea level, rising sea levels, from the disappearance of Mount Kilimanjaro ice cap, that does also affect the livers. That means there's dryness in that area, so drought in places that never been drought before. Also going to the crops yield in South Sudan, in Sudan and Nigeria. There's even predicted that come 2050, it will drop by 20%. You go to atmospheric temperatures, conditions. Look at the people who are depending on fish, that far West Africa. They'll also get affected with availability of fish. So it goes all around. Each part of the continent is affected. And yet, emission of carbon is very low compared to the rest of the globe. So we are the ones who are affected, though carbon emission is quite low. Now it comes that we are also having outbreaks of diseases. We are seeing outbreaks of Marburgs. We're having things that we never had before, diarrheas, etc. And the report that came from WHO that had accumulated a 10-year study reported that out of 2021 cases of public health outbreak, 56% were climate related. So you can see we are even living with a situation that we are actually surrounded with the impacts that we don't even know what are they connected to our own health. And we need to make sure that we communicate to the level that people understand. So the role of NGOs now is actually to get to the community and raise their awareness in a simplified language in a daily living condition. And we have to see how do we need to change the narrative now. You can remove the slide. When we are, no, just remove the slide. When we communicate about cholera, for instance, now I'm told in Simiu, even availability of latrine is very low percentage. Even access to safe water. So you're telling somebody you should have clean water, safe water. But where is the water? And we're looking for the source of water, there's drought. And this drought is due to the climate change. So actually we need to look at adaptation. How are they adapting to this kind of climate change? So NGOs are well positioned in partnership with the government to come up with models and interventions that can actually inform the policy, inform practices, and also making various guidelines. I know at the moment, and I wonder if anybody saw this document from the Minister of Health, is to do with the Health National Adaptation Program for the climate change. I'm not sure if it's known, that document, but it's very important, that document, if you look at that. And through that one, we can see again the role of NGOs. And it's also WHO, which now we can show the slide. WHO has got a framework that NGOs we can actually refer to and work along the health system building blocks. If you can project the slide again. And I tend to agree with Dr. Ntuli that our 6 building blocks do not suffice. And there's so much on the supply side, not much on the demand side. So it's about the health system, people give services, but what about who are supposed to be integral part of the system? So when you use our community health workers, where do they stand in the building blocks? So community health workers, healthcare workers, the frontline workers, are the ones who are implementing direct to the people who are supposed to receive the sorry, the slide is quite low, but we can see the 6 building blocks are in the center, but in the outer layer, we are talking about climate resilience. In the outer layer, you realize each health building block can define an activity that can direct towards climate change. Healthcare workers, how many of our healthcare workers are aware that climate change? I was walking towards this conference area, and I was looking around, and I was wondering, was this done by purpose to be here in an environment, no single tree? And and we sit in the rooms that we have to try and remove your jacket because of the extreme weather. So we are experiencing it ourselves here. And how much of us will come out of this place healthy, I don't know. That I leave it to you, Dr. Ntuli. But again, it's how do we understand about healthcare workers to do with the climate? Leadership, governance, you said it's very well, so I don't need to say much about it. Financing. Globally, there's a global green climate change, green climate fund. But if you go through that funding, it's only 0.5, maybe up to 6% that is allocated to health-related climate change effects. Now wonder if, and while at the same time, you said we signed the Paris Agreement for the climate. If you read that Paris Agreement, over 90% is what we call national determined contribution. But only 0.5 up to 6% is put to health. So what are we doing? So I think that's the role of NGO, to advocate and push on financial allocation to address health-related climate change effects. So we as AMREF, we've got a number of interventions. I don't know whether my time is still there, if I can go ahead, or I can stop there.
We can come to that.
Okay, thank you. So that's it for now, thank you.
Can we clap hands for Dr. Yeah, thank you. Yeah, thank you very much, Dr. Florence, for that. And she has really taken us through the real school of thought on how climate change is really affecting us. I know this early afternoon I met one of the young doctors. She's just seated in front here. And she's really championing for health communications by health experts. So it's really our role to translate all this complex information into a simple language that can be really understood by the communities. We can just go tell people about carbon emission, you know, in that language of talking about how many, what percentage we emit and what is the compensation and so on and so forth. But we really need to simplify these messages. That is really one of the role that sits at the center of non-government sector working together with the government. And we have, I said, we have a father, a mother, and we also have children in this room. I don't mean children like children. Vivian is a global health youth advocate working with the Southern Africa Youth Forum as the head of health cluster that coordinates malaria, NTDs, and tobacco control task force. She's also a member of the Dengue Advisory Group, also a malaria champion. Can you clap hands as we welcome Vivian to the stage? So, as I said, Vivian is a young global health leader. We have heard from Dr. Florence that we need to raise our voices on the challenges that communities are facing as a result of climate change. How are young people positioned within the organization ecosystem, within the different spaces that you have been engaging in, and many other examples that you might have? What is your perspective, and how are young people already positioned to raise this voice to get health fully included in this climate change agenda? Over.
Good afternoon. Thank you very much for the amazing introduction, and I would love, before I answer to your question, to really appreciate being seated alongside the giants in the health sector. I truly appreciate the honor. Dr. Florence, Dr. Ntuli. I am representing young people, and as a young person, it is an honor. Well, back to your question, I would say taking points from the former speakers, especially Dr. Temu had just her speaking points when she highlighted on how there's a huge gap in the integration on matters of climate change and the health sector. So to begin with, young people are truly in different spaces, but the spaces of integrating health and climate change hasn't been quite a topic. It has been a topic where you only talk about climate change or you only talk about health, but there hasn't been quite a powerful advocacy on the nexus between climate change and the health sector. So first of all, just to note on the works of young people doing the job, it is you guys, Amplify Health and Development in Africa. You guys are doing it, being among the few young people in the country, trying now to put this agenda on board and putting it on the table to have these discussions. This platform right here is a true example of what young people do to bring the conversations around climate change and the health. Yeah. So I think briefly I'll just answer to that.
Thank you very much, Vivian, for that very brief and precise answer, that we really need to bring this voice together. If any of you have been at the climate change events, mostly you'll find a room like this seated by all health experts discussing climate change and health, or all this room seated by climate change experts discussing climate change. I think that's one of the things that we really need to change. And I'm happy today we have a minor mix of representatives who are climate advocates in the room. I know the Climate Hub is represented in the room, who therefore was represented in the room. This is the kind of things we need to bring, that kind of integration from ourselves, from individuals, how we organize such kind of platforms, how we communicate the messages. We really need to bring all the voices together. Earlier we saw a video of a young person doing community work, and we heard here a lot of things about communities. We have Isaac, a health laboratory scientist, who does not only want to be at the bench doing the bench work, but rather moving and working with the communities. Isaac is the head of community engagement at Amplify Health and Development in Africa. And for the short time since the organization has been set, he has really done a tremendous work. I've worked with Isaac for 3 years, normally before even we decided, let us set up this formal space. We have distributed mosquito nets, over 10,000 of them, to communities. We have trained over 100 community health workers. This year alone, we trained 20 community health workers. And Isaac has been a really champion for that. Before coming to Zanzibar, I saw he was in Lindi doing the evaluation of the programs conducted there. Isaac, why do you think it's really important to have this component of community engagement? Why it is really important to talk of climate change and health at community level? Can we clap hand for Isaac as he takes the mic?
Hello. Okay, thank you so much. So I joined Vivian to convey my remarks of thanksgiving for I being part of this platform. I'm so happy, and on behalf of Amplify Health Development in Africa, we are so happy to host this summit. And going straight to the point, why is it important to engage community when it comes to the links between climate change and health? We do have all these policies, resolutions, and international conferences coming with, and researchers from academia, coming with so many interventions that we need to implement and to put them in place to mitigate the impact of climate change and health. But all these targets communities. We need to benefit the communities. Communities are the first beneficiaries of all these programs that we are doing. But how now do we put the links between climate change and health and policies and stuff? We need a bridge, and stated by Vice President earlier this year, I think in late January. Now that shows how we really have to use the community health workers, not limiting them to siloed interventions on the common things we know, like reproductive, maternal, and child health. But now we have the new common component of climate change and health. Now it's crucial to involve the community health workers, because we need to bring back the messages, as Dr. Florence was highlighting. Who is going to bring those messages? Because it might be difficult sometimes to have the campaigns that will reach all people. Now that is where community health workers really can play a role in bringing those messages. And when it comes to research, we have research gap in community, in the impacts of climate change at community level. Community health workers can play a role in collection of those information and dissemination of the results back into communities, and even go further in creating the solutions, adaptive solutions of climate change from the end as representing communities. Thank you so much.
Yeah, thank you very much, Isaac. And having heard that communities are important, and Isaac gave an example of the Integrated Community Health Workers Program that was launched by the government. I'm coming back to you, Dr. Ntuli. My central question is that, are we prepared? That's my central question. Now I come to my key questions. We saw when we during COP28, I think that's when the incidents of Manyara happened, when I think it was mud flow, we call. The president had to cease all the meetings and bilaterals that she had in Dubai, and was flown back to Tanzania to support with the response to that incident that happened, which I can allude it to climate change. And we saw a number of organizations running towards Manyara and a number of investments running towards Manyara. I'm not sure if that affected any other sector. I think that will need research. But what are really measures that the government is taking to ensure that we are prepared and we are strong enough to respond? Because for now we don't talk of preventing it mostly. I don't know for your perspectives, but we are talking mostly of responding to the already to a problem that is already with us. How do we recover from the problem itself and then prepare ourselves not to face the same challenges? Over to you, Dr. Ntulu.
Thank you very much. And I must say that you can prevent as well. When you have the weather forecast, you have very good surveillance systems like what we have right now, including the event-based surveillance system, indicator-based surveillance system. We have sentinel surveillance system for climate-sensitive diseases like dengue, malaria, and what have you. So those should be able to tell you whether you shall be experiencing extreme weather conditions so that you can inform the public to be ready for that. But should you fail to do so, then you should have resilient systems to respond and to quickly recover back to where it was before So with Manyara or Hanang landslide, we were taken by surprise. So we had to mobilize resources from different sectors. But the good thing, we have policies in place, and these policies do inform us whenever there is an outbreak, pandemic, or there is a public health emergency of a country concern or of the continent concern, to be able to galvanize ourselves, mobilize ourselves, and respond to that. And this is what we did. Luckily, I was the chief of operations during the Manyala Hanang landslide. So I was actually deputized role by the chief medical officer, who is an incidents manager for all the outbreaks and public health emergencies. So we have a very structured. We have policies in place, and we also have categorized these emergencies. There are some of emergencies which are coordinated under the Prime Minister's office. Those are general ones, but those related to the health, we do coordinate. My department, together with the Department of Public Health Emergencies. So what we did, it was quickly to organize and mobilize our stakeholders to work with the government. So we had what we call one plan, one budget, one report, and one monitoring and evaluation. That helped us to actually align and also to arrange and coordinate different stakeholders who are supporting us. But apart from that, we have what we call the National Health Action or Adaptation Plan. And the first one started in 2018 to 2023. In the meantime, we are writing the new one, which will start from 2024 to 2030. It has about 5 strategic plans, 5 strategic objectives, one of which actually it does spell out including the youth to be part of the movement. And I must tell you that the issue of climate change is not a moment, it is a movement. You have to be prepared all the time. So we have that one. But apart from that, we have also started to create appetite for research in the climate and health. Our appetite right now is quite very low, so we encourage different partners to come forward and invest into research around the climate and health. We also have decided to come up with the coordination mechanism. And maybe because time is not our good friend, I would have also presented on the coordination mechanism which we have, where we have the public sector, we have the non-state actors, the private sector, working together whenever there is an outbreak, whenever there is anything which is related to climate change. But we are also implementing the 3R waste management, that is reduce, recycle, and reuse. So this one has been one of the approaches which we use. Right now, that's why you find when you walk downtown, there will be people who are collecting bottles of water and other things for recycle. But we need also to advance in that area so that we can be able to work together. But the most important thing is that the government of Tanzania have subscribed to a number of protocols, agreements at the global, continental, and at the national level. So starting with the 2008, the World Health Assembly actually came up with a resolution for integration of climate and health. So we were able to take up that resolution and decided to implement it. But in the same year, we had the Libreville again as a resolution. The government was able to take it and also implement it. Apart from that, we are also tracking progress for the SDG number 13, which is on the climate urgent actions to be taken by the countries. But the last one is on the African Vision 2063. The Africa we want is also highlights the importance of the member countries to invest in the climate. So we have done so much, but the most important thing now is to have different stakeholders working with us to make sure that we have a climate-friendly environment, and also we have the resilient systems that can absorb shocks from the climate. So last year, the good thing, or this year, Her Excellency, Dr. Samia Suluhu Hassan attended the COP28, and also she pledged and subscribed to a number of the initiatives at a global level. So we are happy that the political will is there, and for us, we need the more communities joining. And when my colleague was contributing on the community, let us not forget that we are also communities. So we need to create the community at the national level, where we have the community for climate and health. That should be the community. And then going down is where we have the integrated and coordinated community healthcare system. So all these systems must work together. So here, from this panel, we should be able to create another community where we'll be interacting, because even within the climate and health, there's also silos coming up. I was speaking to young people in New York last week. We had those who are working in the environment, just in environment, but pertaining climate. And we had those for health. So you cannot live that way. If we are to move forward, we will have an uphill task later to deal with defragmentation again. If we start right now fragmenting ourselves, we won't be able to tackle this agenda. We need to work together from different communities, like what we have in health in all policies, or One Health approaches. That should be the motto going forward. Thank you.
Yes. I can say, how many wants to be part of that community that Dr. Antuli is talking about? How many are subscribing to that community of practice for climate change and health in Tanzania? Wow, I see a good number of hands. Daktari, una wafuasi wa kutosha sasa.
That is pretty good. So we will find a way on how best we can make sure that we frequently interact, so that to make sure this conversation goes forward. Otherwise, this is an area which needs all of us. We need each other going forward.
Thank you very much. We need each other. I think that's a very important and powerful message, that we need each other. You can prepare your questions. We'll have time we have enough time, I can say. This forum was subscribed for 3 hours, not ordinarily for 1 hour and a half. And we did this purposely, that we wanted all voices heard, all voices put together. But you are not going to sit down for all 3 hours listening. You are going to have some times for interaction, but we'll also be free to sit at some point and have a break. But I want to turn back to Dr. Florence. Dr. Ntuli has highlighted a number of strategies that the government is putting together, including the Health National Adaptation Plan coming up for 2024-2030, all the strategies for supporting the Vision 2063, the Africa we want. And we look up to you as one of the strongest organizations in the country and non-state sector. What is the strategy from AMREF, and what is the plan for the community that will emerge from here going forward?
Thank you. Thank you again. For us, AMREF, we've been implementing activities around environmental health, but also touching on the climate issues way back. But 2023, when we are putting up our new strategy that goes up 2030, when we are counting on the SDGs, we made a deliberate decision to have it featuring in our strategy. So we have a strategy that stands with two major, we call them strategic platforms. And one of the strategic platforms is primary health care. We are doing a lot in primary health care that most of you know, so I need not to go through that. But we said while addressing that, we have a second platform, which is really around social determinants of health. So as what we're saying, while we're addressing PHC as our core area, we should also address social determinants of health. And under that, that's where issues around climate, effects of climate change come in, and the nexus between climate change and health, including responses to some of the outbreaks. So talking about climate change, we are addressing, we are trying to do models and to engage also communities, looking at mitigation, but also adaptation aspects. So I'll set an example. We have a project that we are encouraging communities to use alternative source of energy. And apart from having this normal charcoal that contribute to the carbon emission, we encourage them also to avoid cutting trees, so that we also promote what we call carbon sinks, that the trees should actually be there. So what we have in this program in Dar es Salaam is to do with the waste management from the household level, collecting garbage from the household level, and through expertise that we have in-house, engineer and tourists there, but even other partners that work together, we convert that household waste into charcoal. And that means food remainings, any other dust that we need to be sorted out and identify that is suitable for producing charcoal. So there's a process that goes through that carbonation process. Then we have another charcoal that is less smoke, durable, and also affordable. Through that, we've avoided cutting trees. That means we are keeping the carbon sink in existence. We are also reducing carbon emission, but also create economic source of a socio-economic alternative income generating activity, but also empowering the communities. But we're telling them, much as you can be socially empowered, you need to make sure that you also become socially protected. So encourage them to have health insurance coverage with them. So this has changed their whole mindset. They see the benefits, though the idea is to run away from poverty, but there's also benefit on the health side, because there's a downgrade of water or waste-related illnesses in area where cholera used to be rampant, but this actually contributed to that reduction. So you can see it's multifaceted, though we have done one intervention. So that's really about how to adapt and also to mitigate chances. But again, on the area of early detection and responses, we also have what Dr. Ntuli also mentioned. We've trained community health workers, quite a number of them, over 3,000 of them, on event-based surveillance detection. And I'll tell you, when we had the Marburg in Kagera, is one of our trainee community health worker who actually picked Marburg. And without that training, she wouldn't have known. She picked from the rumors in the village, and it initiated the response. And I have my expert here, Lusungu, and others who are actually doing the job. So again, the same training went to Pemba. And then you heard about the sea turtle food poisoning outbreak. Again, it's the same community health worker who triggered the response, because the ship, when it was notified, went through the response system, the rapid response system, then the action took place. So again, you can see that we have resources in the community. It's just how to use them. And we also have programs, so we take all that in what we call One Health. I think we were also looking that is one health, one life, one world. So it means we also live once. So make sure everything that we know now is not just about a human, or now there's a lot of change in the biodiversity as well. We see the trend of diseases. Places that we never had malaria, we have malaria now. So we are using that strategy, we are deliberate about it. And of recent, we just heard even there's a preterm deliveries because of climate change. So it gets over and above what we thought it is. In fact, it goes beyond that. And I think something that we need to actually emulate and encourage many of us non-state actors to make deliberate decisions to integrate climate change, the effects of climate change in our resource mobilization efforts, but even in our interventions. Thank you.
Wow. I know some of you don't want to clap because you live once. Kona medanganya. Yeah. One life, one health, one life, one world. We live, so we must act now, right? Thank you very much, Dr. Florence, for that powerful message and the great strategy that AMREF has put on place, but already implementing a number of it, a large part of it, especially on community health workers. And we had all the good examples of what community health workers are doing on the ground. Before I go to the audience for questions and contributions to this panel, I'll come to you, Isaac, and then Vivian. What challenges, starting with Isaac, are community health workers facing in response to health issues, particularly now with climate change and health? What challenges do you foresee increasing to them, but also what challenges are they facing currently?
Okay, thank you so much, Alois. One key challenge that I really feel that community health care workers face is that lack of continuous support when it comes to training and incentivizing community health workers, which is the program I think now which has got a lot of work happening to address these challenges. I think that is one of main challenge that community health workers really face. And another thing is like equipments that will support their work. Because when they implement community-based activities at community, they need some supportive equipment to use in their work. So it's something that needs to be addressed so as the intended impact that they can bring in community can be realized. Back to you.
Thank you, Isaac. We really need to incentivize community health workers to motivate them so that they can carry on that work effectively. Imagine if there was no community health worker where Marburg was detected. I can just imagine where the problem, waiting for a specialized care worker to detect that. I can imagine how much it would have been of impact to our lives. And to Vivian, they have talked of community of practice and all the strategies from the non-state actors. What is the challenge that young people are facing to effectively implement their vision and all the thoughts that we have to respond to health threats, especially due to climate change? And from Vivian, I'll open, can the mic go over if the questions, then we'll go to the audience for contributions and questions to the panels.
Thank you very much. Well, to begin with, I would like to, first of all, acknowledge the power and the strength of young people. Despite the challenges, despite the hurdles in advocacy work and championing for the health issues and climate change space, young people are doing it and they're making the most of the opportunities available despite the challenges. And back to you again to commend the work that Amplify Health and Development in Africa are currently doing. And you have to all give a round of applause to this organization starting from last year, August. And this is what they're doing so far. So you can imagine in 5 years to come, what will they be putting on the table for us. So, and another note I wanted to share is to acknowledge the fact that young people are the forefront in ensuring that there are more innovative ideas and increase of grassroots activism. It is quite less to find elderly doing community work in rural communities or in low-level communities. But it is we, the young people, that are usually sent out there to do the real job, the real work, the grassroots activism. And it is we, the young people, who come with new ideas, the likes of Dawa Mkononi, the likes of Mkanda Salama, the likes of Trash to Treasure from Climate Hub. Those are innovative ideas that help to ensuring that health system, the climate change space, something is being done. And one of the biggest challenges that young people face, truth be told, is access to funding. Access to funding, because you might find a lot of youth have amazing, brilliant minds and ideas put in place, but they don't know where to start because of lack of resources. And it is something that I feel they lack the trust from donors, because, you know, being a grassroots organization, just starting from a very low stage, you know no one, or maybe you know some of the partners, but for them to entrust you with resources to start something or doing something, that it's quite a challenge. So I believe there are young people that are doing very well, and once they have access to the rightful resources, the right funding, they will do amazing things, especially now on the agenda of climate change and health. And this is to say, but also we have a challenge as young people to ensuring that we are proving ourselves right, that we can be trusted with the right resources that we're looking for. Because it is not only enough to have an idea that you want to change the community, but it is also what do you have, or do you have what it takes to be entrusted with such resources to actually do the work. Because you present an idea and it turns out you already have the resources, and all you think is, now I need to buy a car, now I need to build a house. You now shift the goal that you started the initiative with to your own personal benefits. So I think it plays both sides when it comes to the issues of funding, but also I believe young people need the right access to the network that are in the spaces, because it is not all partners that you can work with, but there are specific partners that are actually in the niche of the agenda that we're pushing for. So having the right network and the access to the network that will be able to actually support the work. And support does not necessarily mean money, but support can be having Dr. Florence Temu, having Dr. Ntuli on the table, in engaging with young people in the present, and having a conversation and saying what they know, saying what we know, and have a consensus of what we can agree after this conversation. So, so we need access to the right network, and these platforms give us that opportunity to network with such people and with such partners. And of course, we have an issue of having the technical expertise. Young people, as I mentioned, have innovative ideas, have brilliant plans, but there's a huge gap in having the right strategy in actually implementing what we have, bringing the idea into a practical concept, bringing the idea into a right strategy of implementation. But of course, lack of skills. Now we're moving forward into an AI revolutionized world, and it's all about tech. How are we going to engage the technological advancement to combat and bring solutions in the issues of climate change and health. Now, young people need to have the right skills to actually put them on board to making those solutions, to writing them down, to think about them and making sure that they're actually feasible. So all of these things, and of course the right capacity building programs and mentorship programs, because you might have the skills, yes, you might have the idea, but you lack the right attitude to actually approach these people. Because no matter how smart you are, no matter how much you can deliver, you also need to have meaningful relationship with these people, because you're not only engaging with an organization as a name. If I'm working with AMREF, I'm not working with AMREF the name, I'm working with people in that organization. So how am I brought up, how am I mentored to actually rightfully engage with these people that are in these spaces? Because, so now young people also face that challenge to lack the right mentorship. And of course, I really acknowledge the YOCAB program from the THS. They have done a brilliant job over 5 years. We have seen the fruits, and I think, Alois, you can also testify to that. And another thing is, another challenge, just to wind up, is being informed. Because if we young people, we claim to be denied the space to be in the rooms, or we are denied the tables and you're told to bring in the chairs. But of course, if we are demanding opportunities to sit and speak and representing other young people in the spaces, but are we rightfully informed, or are we engaging because I came to a climate change and health forum? Or you're attending a summit because you know I will meet certain people and take beautiful pictures. We have to have conversations about this, because that's not going to result the impact that we're looking forward to achieve. So thank you very much.
Yes, thank you very much, Vivian. I cannot add anything to that. She has really broken down all the issues, from the strength, opportunities we have as young people, and the challenges that we are facing, and I'm sure our seniors have heard that clearly. Can someone take the microphone? And I see already some hands. Yeah, I see many hands now, which I'm going to give the mic, and I'll start from back. But before, I see some people are just staring at this word here, Jamii Shupavu. What does it really mean? Before saying what it means, today from 7:30, you have seen on the program, there is a cocktail part, and we are happy to have been part of that as a cocktail, to support that cocktail event. Today evening, you are all invited, all THS participants at Stone Town Hall. And one of the key things we wanted, a very small message we want to bring to that cocktail part, to the whole audience of THS, is we need to create a strong and resilient community. In short, we just called it, a quick translation we've just found quickly as a team was Jamii Shupavu. It's a campaign to ensure that whatever you are doing in your space as a healthcare professional, make sure it intends to build a strong community. Because if we only have a strong community, a strong individuals within the community, then it will be very easy to respond to all the threats that we are discussing. If we had a strong mother who understands what to do after seeing a child with fever, instead of just going to a witch doctor or doing something just ridiculous, if we had a strong mother who understands clearly what to do, we could not be suffering from all huge numbers of malaria. You know, Tanzania is among the top 4 countries which are contributing to highest number of malaria deaths in Africa. In the world, by the way. We are top 4. Among the 4 countries that contributed to more deaths in malaria, Tanzania was number 1. What do we do? From the communities, we must build jamii shupavu zinazoweza kukabiliana na athari zote za mabadiliko ya tabia nchi and all the challenges that we have in the health sector. Can the mic go at the back? We start with Dr. Nkoronko, and then we'll come this side, and then we'll go back all the hands will have a chance to speak quickly, and then we'll come back to our panelists for a closing word. Thank you.
Thank you very much, Mr. Moderator. Climate change. My name is Dr. Mugisha Tionza Nkoronko. Come from the Benjamin Mkapa Hospital in Central Tanzania, and I'm the president of the Medical Association of Tanzania. I'm very happy. I am very happy that today we are having this particular talk, which is very important. And I think this is now the directions of how we should be thinking in terms of healthcare. We can't leave behind climate change and healthcare. It has two major impacts. We see the climatic catastrophes that happen because of climatic change cause a lot of harm to people and the population, and eventually they require some sort of healthcare into them. We may remember the landslide in Pare Mountains and the ones in Manyara. Many patients, many casualties ended up into the hospital in all forms, including mental health. So it is not a thing to remain behind as healthcare providers within the country, not to think about it. All protozoan disease and many other helminthic diseases are also contributed by climatic change, and they are changing so rapidly. They are mutating. A lot of things is happening, and we are going to have a very different type of diseases in the near future because of climatic changes. If we don't take it into the focus, for sure we won't be able to overcome. Number two, I would like to now, because we have Ntuli and the likes, to spearhead really climatic change issues within the ministerial level. We need to have a focus team and well-dedicated personnel within the ministry who can champion this, not leave alone only through the Vice President Office who coordinate for the environment. We need to have some people specifically dedicated into looking to these particular things from healthcare perspectives. I am a surgeon and I work in operating rooms. In a day we experience power cutouts 4 times, and sometimes we are doing a very delicate procedure. I've been into lower health facilities whereby I had to deliver a child using a torch when electricity went out. This is high time when we are designing our buildings to incorporate green energy, to make green theaters, so that we can have sustainable surgical care in all facilities that we are delivering CMOCs. If we don't have that person within the ministry, they will continue designing things that won't fit into this environment that we are in. Lastly but not least is about recycling. When we are using waste, when we are delivering healthcare services in the hospitals, we tend to use a lot of water. Surgery, 1 laparotomy for intestinal obstruction consumes just running water. To scrub for 3 practitioners, almost 60 liters. If I operate 3 cases in an operating room, then I'll have consumed almost, you can see, 460 probably liters just for one day. I'm operating maybe 365. You can see how much water are we losing. We are not measuring it, we are not accountable for it, and we are contributing to water loss within the hospitals. I understand the specificity that we need to look at in terms of infectious control, but we can recycle. We can recycle water from operating rooms and irrigate the gardens. If we don't have people within the ministry to think about that, we'll never have those particular sustainable solutions into. Look at the waste production. Theater alone produces 60% of all the hospital wastes. This includes human tissue, includes any other things that have been consumed, including nylons and plastic materials from the bottles we use. If we do not have people within the ministry to discuss and design policies around this climatic change, we will continue doing the same and not having the results. With all due respect, I would like to submit. Thank you.
Wow, thank you very much. We'll go to this side and then we'll come this side and back to this side. Thank you very much, Dr. Mugisha. Yesterday someone was asking me about doing a research on the impacts of clinical surgery to climate change. I went to sleep with that question, but at least I have some answers now. I'm sure he's in the room, so he has also gained some answers. We can go to that side and then this side, at the front and then back. Yeah.
Yeah, thank you so much, Alois, and the whole panel for the nice discussion. It's very productive discussions. And my name is Shaban Busega. I'm from Mohas Digital Health Unit. And I want to add something on the use of community health workers. We understand that currently the Tanzania governments, thank you. The Tanzania government have made a lot of effort in strengthening community health workers. And if we break down the issue of climate change to the smallest detail, you'll understand, like, right now it's become like a behavioral change, you see. For example, climate change may have direct impact, maybe floods and so forth. But there are small issues which may be, like, for example, we understand many people have maybe NCDs, maybe like hypertension. So the effect of climate change may be increase in temperature, which increase the intensity of a certain kind of disease, you see. So there is a need to introduce like a behavioral change that will help people with certain health conditions to try to avoid something that may result into a huge impact according to their health conditions. So if, for example, we can use efforts on increasing awareness on community health workers, and those community health workers have been assigned to a certain number of households, and they don't meet them at once, they meet them regularly. So if there will be like a continuous effort on increasing awareness among community health workers, it can help like to bring that massive behavioral change among the community in order to adapt from the impact that can be coming from the climate change. So I think that is very important also to consider. Yeah, thanks so much.
Thank you very much. I think behavioral change, that is also a very important component. We can go to the center, start with A. Yeah. We'll go to the lady behind.
Thank you very much. My name is Ghalib Kasim from Himbili National Hospital. I have a question to Dr. Ntuli on regards to policies on waste management. I would like to commend the government first on environmental conservation and the campaign on clean energy at the present. And Dr. Florence has also hinted on the production of charcoal from waste, from other waste. But please inform us on the policies we have regarding electronic waste, because they produce a lot of emissions that are harmful to the environment and to people's health. But what do we do and what do we have at present with regards to electronic waste management? Thank you.
Thank you very much. I think Dr. Ntuli and Dr. Florence, you can discuss that. That was also part of our next question about the digitalization stuffs and so on. We can go to the lady and then the other.
Good afternoon. I'm Queen Ruth Msina from Pharmaxis. I would like to congratulate you on a very good forum, considering that now climate change is an area of interest. So I would like to talk about community health workers, to be specific, because I know that the government has already launched the community health program, and we anticipate that since there's a lot of training going on, there's going to be, I am sure they're going to be given blood pressure machines and other machines to actually be able to do the test. And we anticipate that these machines actually use batteries. So we can imagine with community health workers being in the community, there's going to be a lot of disposals of batteries, considering that maybe one battery goes in 2 days or something. So I just wanted to come with a proposition, since we were talking of climate change and community. Why don't we explore green energy, more of like solar power banks? I think there are options that could actually work in a very long time. They take longer to discard, and I think it's also cost effective, because we're sure that sometimes these HWs, we can say that they get so much incentivized, and sometimes they cannot leave people in the community to suffer, so they have to use their own money to buy these batteries. But if we explore the green energy, it can help to save costs and also save the environment. Thank you.
Thank you. I'm sure Dr. Ntuli has taken the point. Maybe Pharmaxis can be one of their partners to make sure there is that green pack for community health workers. Another lady here, and then we come this side. Yeah.
Good afternoon. My name is Mary Mboneyo Naza. I'm a medical health in charge at Newala and Chiwonga Dispensary in Newala District, and currently a medical student at Kampala University. So my question goes as, we know all the campaigns that have success in our communities involve community leaders. And we are with policymakers. I'm talking to Dr. Ntul specifically. What are the involvement of community leaders in making sure that they are educated or empowered in knowing the climate change and their health effects that comes with climate change? Moreover, how are they prepared? We all know that most campaign which concerns climate and environment, these community leaders help a lot. For example, those cleanness every Saturday, we all know how effective it was when community leaders are involved. So what are the policies involving them, community leaders, in making sure that we improve in that? Thank you.
Thank you. I think the question is noted. We come to this side. Was there a question here? At the front, and then we'll go here, and then we'll be back to this side.
Mimi naitwa George kutokea UNICEF. Naomba niongee Kiswahili. Kwanza, wakati tunazungumza mambo ya climate change, tunalaumu sana wenzetu. Lakini nikiangalia from your household level, how many of us we have planted a tree on front of our house? Even a single one. Tuanzie hapo. Then we ask ourselves, tunatumia mkaa au gas? Hapo tunazungumzia namna tunavyo contribute kwenye global warming. Then eventually you learn that we have a footprint that we have to contribute to change the status. Badala ya kulaumu sijui nchi zilizoendelea wanatumia fuel, hata sisi tunatumia. Na nikiangalia nchi zilizoendelea, miji mikubwa kabisa, they have a park. I'm not so sure if we have any city in this country ambayo we have a park. Of course they have seen, but a very small scale compared to the size of the land that we have. So probably we need to think of ourselves. Instead of thinking about others to give us money and those kind of things that you're saying for the COP, whatever, probably we need to think about ourselves. We're the one who can change the fate of our nation for the climate change, for our health. Kwa hiyo nilikuwa jaribu kufikiria katika Kiswahili. Maana nafikiri tukiongea Kiingereza wakati mwingine najikuta tunaongea vitu ambavyo probably ni abstract. Nikiangalia pia kwenye swala la matumizi ya solar at the household level. For the developed countries, naona wana wind turbine, wana solar panel kwenye hospital, at the homes. Now, yes, wana umeme wa kutosha, but what do we do for that? And then looking at the challenges of urbanization, floods, our cities are not planned. So eventually you'll see that most of the infectious diseases like cholera, hata hizo malaria, hivyo madimbo ya maji everywhere, pothole everywhere, then no one to blame. So it is ourselves who need to change. At the mbele ya nyumba yako, do you have a garden ambayo inafyekwa? Eventually mbu anazaliana pale. So we think of like foreigners, we think of developed countries to come and help us kwa ajili ya spraying. Kwa hiyo probably we need to rethink about how we think about the climate change and about the foreign aid, about what we can do to change the situation. Na jambo la mwisho labda ningesema kwamba when I remember the government when decided to abolish the use of nylons, most of people thought it's not possible. And now I think we are among the few countries in the world ambao hatutumii nylon. Hata ukiangalia nchi zinazoendelea wanatumia nylon. So I think it's also possible, also for the government. Of course, eventually the political will, akisema raisi, everyone will follow. Kwa hiyo, swala la miti, mimi nafikiria mambo maraisi tu, mambo ya kufikiria si innovation, nini. We don't need innovation sometime. We first need to think of the basics. Kabla ya kufikiria to take solution and so forth. Those are my few cents. Asante.
Thank you very much. And so we'll have 4 more questions, but please keep them brief so that our panelists wamekaa sana. Keep the questions or comments brief. Go to Dr. Mushia. Go to this. Okay, we'll do this. I'll finish this side and then I'll come this side and finish with this side. Dr. Mush, and then there's Madam pale alikuwa amenyosha. Yeah.
Okay.
Shortly.
Asante sana. Na mimi naomba niongee kwa Kiswahili hivyo hivyo. Kwenye habari ya climate change, tunaangalia kuwa na systems ambazo pengine ni zinazohusika na delivery ya health system, ya hiyo health services na pengine na hiyo na uptake yake. Turudi kwenye holistic part kama alivyokuwa amehinti Dr. Kapologwe, with a particular example of floods and landslides that we had. Utakuta kuna so many other sectors beyond health. So what we have in place to coordinate, kwa sababu at the end of the day pia health yenyewe inaguswa na hizo sekta nyingine, lakini pia wana commanding chain. Kwa hiyo sasa tutazungumzia climate change and health, climate change and agriculture, climate, kila mmoja na cha kwake. What are we doing ili kuweza kuhakikisha kwamba hizo workforce tulizonazo hata duplicate na resources ziweze kwenda mbali zaidi. That is number 1. Lakini effect nyingine ambayo ipo wazi ni kwenye transport systems. Tutazungumzia kwenye land X katika developing countries. Sijui nani ambao wanafahamu public transport zinazotumika kwenye majiji makubwa, ambazo utakuta congestion ni kubwa ndani ya ile mifumo. Ni wakati wa joto kama tunavyoamika, pengine hata baadhi ya venues za mikutano hizo, pengine kuna watu pia wanakuwa vulnerable, wanakuwa exposed kwenye situation ambayo inaweza kufanya wakaumwa. Sasa tuiangalie hiyo health kwa mapana yake, ili tuweze kuona pia kwenye transport, pia kwenye public transport, na ifanyaje nayo iweze kuwa salama katika mazingira ambayo tayari tumeshasema hali ya hewa tayari imeshabadilika. Mpaka miti yetu yote tunafikaje iwe mikubwa na hali ya hewa iweze kurudi kwenye mifumo ya usafiri, hata kupunguza zile congestions ambazo zinakuwa avoidable. Asante.
Thank you very much, Dr. Mushi. Not to tire much our panelists, ningeomba wajibu kwanza alafu tutaendelea kama nilivyosema. We'll start with Dr. Ntuli. We'll back to the we'll get back to you.
Thank you very much, and I must commend all the people who asked questions. The questions asked are quite very pertinent to what we are discussing here. Maybe starting with Dr. Mugisha, we have now a dedicated team at the ministry, but also we work hand in hand with the Vice President's office and the Prime Minister's office, trying to implement the Common Action Plan. But I must admit that the issue of climate change, it might sound that it is an old one, but when it comes to Tanzania, I might consider it's relatively new. That was I'm very happy to see the group of young people organizing themselves, coming up with this type of platform where we can discuss and move forward. But I must challenge them that sometimes starting these ideas is quite very simple, but sustaining them is one of the huge challenges most of the group they experience. So I pray that you should work together as a team for the common goal. That is the most important. But at the same time, you must acknowledge the role of elders in the field or in the fraternity who can guide you to reach to the high heights. But the other thing, it was the issue of recycling. Well, we have already the policy in place which works, and the most important to reinforce the law. But we have policies in place, and we have also the strategies in place. But with regard to the question, I think it was Hussein who asked about the number the community care workers that attend per day. So with our new guidelines for community-based health interventions, they are supposed to visit between 70 to 100 households per month. And we have about 7 modules, including issues to do with the climate and health. But the most important it will be for us to make sure that whenever they visit these households, they are having a very comprehensive checklist that do not leave anything behind of relevance. But at the same time, we must be cautious of not overburdening them so that they might end up being burnout, having burnouts. And there was this, the issue of waste management. Well, we have 2 acts. One is an Environment Act of 2004 and the Public Health Act of 2009. Both of these 2 acts, they are very clear when it comes to the waste management, both solid and liquid waste management. But the most important is now there's opportunities, and some of the regions and districts in the country that have been able to take up those opportunities, especially the carbon credit facility. In Iringa, Katavi, they were able to exploit those opportunities. So we encourage different regions to come forward so that they can be able to take up those opportunities which deem to be very important. The electronic waste management, these 2 laws which I have just mentioned, they do not segregate whether this is electronic or non-electronic. All wastes are treated equally. So the most important is to reinforce these laws, because still we haven't gotten to the level where you'll have people being sensitive with having clean environment. Now we are implementing the Mtu ni Afya campaign. And the Mtu ni Afya campaign, it requires us all to be able to clean our surrounding within 5 meters. But a few people that have responded to that, and this is to respond to what my brother George has said or asked, that sometimes we have these campaigns, we have these laws, but these things are social behavioral. You have really to invest into the behavior thing. Even this one, the climate and the earth agenda, for us to succeed, we will have to design a campaign as well. But we cannot be sitting here only there like speaking to each other without engage the wider community or the general public. You will have to design intervention. The good thing is my department responsible with these public campaigns. So we can sit down, and that's the role of the community of practice. Design the campaign, and we should be able to measure the penetration of the campaign. After a year or so, we shall come back and say, this is what the campaign has been able to do in terms of transforming our societies up to the household level. And there was this issue of engaging community leaders. The beauty of Tanzania, we have a very good dialogue structures from the national up to the community level. We have the National Steering Committee. We have at subnational, we have the steering committees at local government level. By going down at the ward, village, and hamlet level, we have also committees responsible with the environment, climate, and what have you. But the most important again, having the group of these young people who are ready to frontier this agenda. We can work together so that the community leaders, they should be made aware of this agenda. But again, I said, let us not use one approach. We should have multiple approaches so that we can be able to reach out to the wider population. And last, I think this was how do we engage the sectors outside health. We have been having a couple of meetings and platforms which brings together all stakeholders in the climate and health. And these meetings and platforms seem to be working pretty well, but still we need to sustain. So I must say, before I conclude on my side, that this arrangement and the leadership that have been shown by the young people here, it is commendable. We need to support them. We need to learn from them. And we need to run away from the status quo that we, the elderly, we should be the one to come up with ideas. They have done something good. We need to embrace, we need to support them all the time, and let us make ourselves available for them to reach out to us, get our ideas, get different thoughts on how best they can move this agenda forward. That would be my plea to all of us.
Thank you. Okay, thank you, Dr. Ntuli. If I'm to add, I first want to appreciate Dr. Kamugisha's sentiments on the health sector, particularly health facility. And it has been documented that our health sector, actually, and health facilities are main contributor of the waste towards the carbon emissions. So I think also it's very important that we look into that. And we know even when you plan to put a health facility anywhere, and this should go even to private sector, we are advised to do environmental impact assessment before you put any health facility. And oftentimes we tend to forget that. I think it also help us in terms of where to erect any facility. But also use of technology is very much useful, especially in the recycling of waste, but also water sources. And we are also doing that in part of our circular economy. I want to comment on, as regard to policies. Dr. Ntuli has explained the existing policies, but I want to encourage my fellow non-state actors. Even where there's no policy, we are there to show what works, what doesn't work, and influence policies. And also to suggest policy dialogues so that we can come up with suggestions how to either an improvement on the existing policy or creation of a totally new, if it's not represented anywhere. So I think that should be part of our responsibility, especially noting that climate change, even in our health sector strategic plan, is not been mentioned. Yeah, it's taken like implication. So how do we, when we give comments in our health sector strategic plans or in sector review meetings, how do we connect with reality? I want to comment on, I think most of the thing has been answered, but I want to comment on what John George said. And since he said in Swahili, na mimi naongea Kiswahili tu. Ni kweli kabisa nakubaliana naye kwamba na sisi tuanze na sisi kujiangalia sisi tunaweza tufanye nini. Sio tu tunaangalia wenzetu. Lakini ukweli pia kwamba sehemu kubwa imetokana na industrialization from the developed world, na sisi pia tumekuwa affected. Pamoja na hayo, tunaweka resources gani kama katika sekta zetu zote, because this is a multi-sectoral issue. Lakini tumechelewa sana watu wa sekta afya kuingiza hii kama agenda. Kwa it's high time hata sisi wadau wa afya tuanze kupush kwamba this an agenda needs also to have resource allocated to. Tunajua environmental health fine, tunajua maji salama fine, lakini when talk about the impact and effects, infrastructure tunazozijenga. Kwa mfano tumetokea umejenga nyumba, how do you allow aeration in your house? Na tunaongea masuala ya TB na kitu kama hicho. Disposal in the household level, how do you make sure that there's a proper disposal badala ya kuwa na collection of water ambayo itatengeneza mazalio ya mbu na wengineo to eliminate vector-borne diseases. Kwa natakiwa ni vitu vingine tuelimishane. I think what is missing is how to connect, what to educate our community and the effects of climate change. To simplify your message iweze kuingia vizuri. Kwa nafikiri hiyo nakubana naye kabisa, need to rethink na decision making ita influence. Na nafikiri hii iende paka kwenye kamati za chini kabisa za afya. Nashukuru Dr. Ntuli, you mentioned about we have got a very good structure, which I totally agree with you. The problem, how are we enabling these structures? Are they informed? Are they even capacitated? Not just knowledge. Unakuta katika level paka local village level, kwa sababu ni sheria inahitaji kuwa na kamati ya afya ya kijiji, itakuwepo. Kwa sababu inatakiwa kuwa na ward level, itakuwepo. Zitakuwepo zote. Lakini what do they do when they meet? Do they have the right capacity? Do they have the right resources? Do they have the right information? Na wanafuatiliwaje kuwezeshwa? I think that's a thing we need to see. How can we mainstream climate issues into those grassroots kind of structures that are very well positioned to influence policies, but also the informal structure. Na inapenda sana kusema mara kwa mara kwamba tusisahau kuna informal structure kama za viongozi wa kaya, clan leaders. They are very influential. Community, hata wale nani, toboa waganga kienyeji na wengineo, they are also very influential in decision making. So we need to also to remember them in how we put our policies right. So I'll stop there and let my colleagues respond. I think most of the things Tuli has done. Thank you.
Bring the panel. Yeah, so before I give the closure to the panels, I'll just 1 minute each and then the panels will close our conversation. Tunamaliza with this side. Nilikuwa nimeona mkono kule nyuma, and then we'll come this side. Pale. And then we'll come here. Beautiful. So here there is 2 hands, there and here, and then upper. Oh, okay, just briefly, please, very brief.
Okay. Good afternoon. My name is Dr. Genoveva, and I had one question to Dr. Ntuli. Is there any government efforts that are being done to incorporate the topic of climate versus incorporation with health in the smaller generation, like in educational system? Like just like the way we were singing about HIV for years since when we were in standard 3, and then when we grew up we knew like HIV is bad and how to prevent ourselves from HIV. Is there any efforts that government is putting into incorporating this topic to the syllabus system of the younger generation, so that even when they grow up, if our target is maybe 2050 or 2030, I feel like they need to be aware of these situations since when they are little kids, so that when they grow up, even and they hear about health versus climate, they don't be surprised like how is climate related to health. Because for now, majority of us, when you talk about climate, we all think of geography and maybe soil erosion and things like that. So I think if younger generation, if they're educated about the climate versus health, it's going to be easier for us to solve the problems that are caused by climate on Earth.
Okay, thank you, Dr. Genoveva. Back to Baba, and then we come this side. Okay, Mama, then Baba. Okay. Just 1 minute quickly to find
Yes, thank you for the very good presentation, Dr. Florence Tuli and the youngsters. Mine is like a challenge to the organizers. This has been a very, very peculiar and very smart way of organizing a forum, and a clap to you. Mine is, do we see this more? This is the 11th Health Summit. I wish in 5 years to come, we can have a more organized forum, including all the key players. When you talk of climate change, you have it impacting while there is a hazard or catastrophe, where you have people from the prime ministers, president, coming in. And if they were here, you could have more input. So I hope we can have this kind of forum, but incorporating all the key players, inviting them and discussing. And to the youth, I think we need to look for more like Isaac in the community, bring them abroad, make them compete, and maybe you should think of awards in the future to make more youth to, youth really need to be praised when they do things. So if you could organize awards, Look for them. You have the entire year to search for them. Let them come to here, talk to us, and we can have judges and give them awards. It doesn't cost a lot. Thanks a lot. Thanks a lot. It was a good forum.